Cutler. I'm the Nevada County Public Health Officer.
Alrighty. Okay, so is there any new information about this measles case today?
So far we still have one confirmed case in our county. As people know, there was an exposure at a school. Initially, 124 students who were present that day did not have documentation of immunity to measles, so they were excluded from the school and asked to be on home quarantine. That number, because people have been able to update their records, is down to about 98 that are at home.
Okay.
We've reached out and made contact and attempted contact with each and every one.
Okay, and so first, this is the only case in the state right now too, right?
Yes, I'd like to confirm that as far as I've been told today, we only have one confirmed case of measles at this time in the state of California.
Okay, so about 100 students who are going to be at home quarantined for another a week and a day. So that's about a third of the students at that school. So can you just talk about the impact and why that's necessary?
Right. So measles, we know, can be very highly contagious. It can depend on how close you are, how infectious the person is at the time, and we want, because schools have a lot of movement and are fluid, we wanted to make sure that anyone who was possibly exposed in that school who doesn't have documentation of immunity was in a safe place, and that safe place is at home. So should they get sick, their parents can monitor, talk to their healthcare provider, and let us know without having other large exposures, so that they're not out at a church or in a schoolyard or in an arena or in a playground with other kids, or in a healthcare facility where they may be exposing people who are pretty vulnerable, like babies.
Are all of those children who are at home being tested for measles?
No. What we're asking is that they're monitoring for symptoms. We're contacting them. We're answering questions. We're trying to let them know what to look for. That was included in the parent letter as well. And then should symptoms develop, there would be a consultation and see if testing is indicated.
At this point, what do you think is the likelihood that there will be more cases here in the
Yeah, I
county?
would not speculate on what the likelihood is. We do know that it is a very contagious disease, and so we're planning in case there are more cases. Certainly we hope there aren't, but we are planning for that possibility.
And as a health official, I mean, what's your reaction to the fact that, this happened here in your county, and now, you guys are kind of having to do all of this, you have a clinic, keep kids home from school, and it affected another county as well. So what's kind of your reaction that something like this happened?
Well, I hope it raises the awareness that measles is just a plane ride away. Even though we haven't had measles circulating naturally in the United States since the year 2000, it can be re-imported into the United States. So it's very important for people who are planning travel overseas to be well protected, and vaccinations are your best defense.
So you advise people to get vaccinated?
Absolutely, yes. MMR, the measles, mumps, rubella vaccine, has been shown to be quite safe. It's very effective at decreasing your chance for getting measles. It's not 100% protected, but if you get one MMR, the chance that you are protected is about 93%. If you get 2 MMR, that goes up to 97%.
Word is going around that this is one of the counties with the lowest vaccination rates in the whole state. So first, I know there were some numbers floating around. Do you have any numbers about the school-age children, the percentage that is vaccinated right now?
Certainly. So in our current kindergarten class in the western part of our county, the up-to-date for immunization rate is about 77%. And that is low for really protecting the community. So we do want people to be aware, and we want to improve that vaccination rate.
And at this particular school, it's like 43% or something. It's a lot lower, right?
It's close to that.
Do you hope this wakes people up and gets them out here, get vaccinated, and makes people kind of take action?
Yeah, we're hoping that this will raise a certain level of awareness. We understand that parents are trying to make the best decisions for their kids, and for some that hasn't been vaccinating, this may prompt some to change that.
Okay. Do you have any other questions?
So we're standing here in the parking lot of the Twin Cities Church, and you have a drive-through MMR clinic going on right now?
Yes, that's about to start. The state has been very helpful in helping us to obtain many doses of vaccine to protect against measles, and we've asked that people come drive through. That way people aren't congregating together when we're concerned about measles possibly being transmitted, and this will help protect the community for future events.
And just can you briefly touch on Amador County Health Department sent out also an advisory. They were looking for people who possibly were at a restaurant on a Saturday. So that is the same case. It is the family who traveled to Amador County?
There is one confirmed case in the state of California, and it's not unusual during a time period of being contagious to others that there's some travel. But there is only one confirmed case.